It's very simple. Screening and surveillance colonoscopy can save your life. So colonoscopy is the only test that can detect and prevent colon cancer. We know the natural history of colorectal cancer. It starts with polyps that eventually become advanced polyps and can turn into cancer. And so our goal is to interrupt that natural history and prevent cancer. So the main thing we want to do is prevent colon cancer by finding polyps, removing them, and therefore preventing the onset of cancer. And colonoscopy is the gold standard for that because we can actually see the polyps, remove them, and that makes the most sense. There are some stool-based tests, most notably Cologuard, and there's challenges with that. This is a test that's highly marketed. It seems easier, more convenient, but there's some realities people need to understand. First of all, it's a test that screens for colon cancer, so it's not preventative. And actually, if you have colorectal cancer, the test may be negative up to 13% of the time. It doesn't really make a lot of sense to have a test that only screens for cancer but doesn't prevent it and can miss cancer. That's why it's a challenge to just depend on Cologuard versus something like colonoscopy. Colonoscopy is more sensitive at finding early cancers. At South Denver GI, we measure quality parameters for all our physicians. We want to make sure we're doing the best we can to prevent colorectal cancer. One of those metrics is called ADR, or adenoma detection rate, and that really means on any given colonoscopy, for an average risk patient, what's the chance that the physician will find an adenoma? If adenomas are left behind or not seen during a colonoscopy, that increases the risk for cancer development. And so in our practice, we have very high rates of adenoma detection rates for all our physicians, and a high rate means that they're really good at finding polyps. And patients really should seek out physicians that have high ADRs, which means they're more likely to find polyps and they will benefit from that, and they're less likely to have cancer in the future.